I'd like to formally welcome all of you to Kleiner Perkins' first ever Designing in Health event, which is a big deal, I think. Thank you. And the motivation was Lynne Chou here, who I got the chance to sort of like talk with after we had a big design event at Uber, right? And Lynne is one of our investing partners. And I just remembered after the Uber event, there were all these designers all around Lynne, you know, like she was Bono or something, you know? And they were like, oh my gosh, you know, health, it's design, it's so important. And Lynne just like said, we've got to have an event where we bring together health and design. Lynne asked if I could like give an overview of the health and design space. And I actually, a long time ago, and I'm going to show you some excerpts from the Design and Tech Report, which touches upon some of these thoughts. But a long time ago, I gave a talk at TEDMed, and this is an excerpt from there. Design helps you see things, as you all know as designers. This is an example by one of my former PhD students, where you see these beautiful columns of numbers, and you're like, well, what is that? What are those columns of numbers? And if you kind of like look at the numbers, on the left, it says random, right? Red dots. And if you look at the one in the middle, oh, look, it's a line. And so your brain says, I get it, you know? If you look on this one over here, it's a circle. And so the picture tells something that the numbers have a hard time getting to you, and therefore you can imagine that design plays this role of creating clarity. And if you think of the famous example I found in the health and design arena, it was the work of Florence Nightingale. Ever know Florence Nightingale? You know, I read this Gold Key book where Florence Nightingale was a nurse that helped the British soldiers. Turns out she was the world's first data scientist, right? Much better. And what she did is she made a diagram to show the government that soldiers weren't dying in the field, they were dying in the hospital. Because of the condition of the lack of cleanliness in the hospitals. And so it was an example of where a diagram changed national policy. So design played a huge role in that moment. This typeface, do you guys know this typeface? People make fun of this typeface. You can there's Tumblrs about it, like I hate Comic Sans or whatever. And people always say to me, John, you must hate Comic Sans because you're a design guy. And I always tell them, no, I don't really care about Comic Sans. Comic Sans is totally okay, you know, because Comic Sans is a typeface. It has a certain kind of look and feel, what we call form. It's an informal handwriting style. It looks very informal, right? I just drew it with my hand. And then there's content. So Comic Sans was probably designed for a certain reason, for a certain purpose. I wonder what it was designed for. What do you think it was designed for? Maybe it was designed for comics, right? So Comic Sans is a perfect typeface for comics. Let me give an example. So if you have like a medicine bottle in Comic Sans, you're like, whoa, not sure. And if you had like Mouse Man talking Helvetica, like holy moly, Catman, use your utility belt. It's like, it doesn't feel quite right, right? But if you put the Helvetica on the medicine bottle, it's like, that is safe medicine. And if Mouse Man's talking in, oh, that's totally funny, you know? So it's an example of where design has to fit the situation, the shoe fits. Designers can find the right shoes to fit the right person. Creative and safe in the health area is a different factor. I mean, you can't really make things up. You know, when you're creative, you love surprise, but safety is about no surprises. When you're creative, you love to like try things out. But when you're in health, you don't want to do any harm. So you might not want to try that out. And so it's a whole different thing. And by working with Lynne over the last 2 years, I've gotten a sense of like, this is a very different domain in which to design for. And at TEDMed, I showed this slide, which made no sense to me at the time. If you look at each quadrant, the health area was about to be disrupted. And when I talk with you all the time, it's clear that's been happening. And so it's so great to have this first design gathering in the tech health space. And if you haven't seen it yet, there is the Design and Tech Report. It's available online, and you go to designin.tech. And here's some highlights. It's the fact that technology used to be a reason we'd buy things. If it had more RAM, more CPU, we'd have to have it. But now we're pretty satisfied. And so how it feels matters more than how much RAM, et cetera, it has in it. And that's a recent shift in the last few years. And also, the idea of design has to change. And so I've been showing this slide to show people that design isn't how pretty it is. It's how smart it is, really. And this example from the 1800s. This is a Vienna coffee house chair. And this is a perfect example of great design. A woodworker discovered a way to bend birchwood with steam. So he patented the process. This is the early 1800s. He had factories across Eastern Europe, showrooms in Moscow, Chicago, et cetera, all over the world. And this chair has sold 50 million chairs to date. A special factor of this chair was that you could take over 30 of these chairs and fit them into a 1 meter cube box. And this is in the late 1800s. And so beautiful design, easy to sit in, patented process, logistically sound. Sounds a lot like Apple, you know? So the Apple way isn't a new way. It's a sound way of doing business with design. And when you look at when this report was launched, we highlight, and Jackie Chou is here, by the way, my partner who worked with on it, and also Aviv Gabola. 27 startups co-founded by designers, 13 agencies were acquired, so a lot of activity has happened. There are startups that have been funded at the level of billions of dollars that are co-founded by designers. And so you often hear how designers aren't at the table, but a few $1 billion means you're at the table. And also, since I was brought into the venture capital world, more venture capital firms have brought in designers as well. So something is happening in this space, and we're observing it, and we're very proud of it as well. But again, caveat, design in the venture capital startup space is not about pretty. Everyone comes to me and says, John, this is really beautiful. You're going to love it because you're a designer. And I'm like, no, I don't really care if it's pretty. You know, it's nice. It's nice to have, but it has to be relevant. That's a very important thing. And lastly, good design is good business. It's not a new idea. IBM's T.J. Watson Jr. Put this into a memo in 1966 to all of IBM. First line reads, good design is good business. And so that's IBM. And IBM was reacting to the fact that Olivetti was beginning to lead in the office machine space because Italians were so good at design. And if you look at IBM and who they copied the Germans. In the early 1900s, there was something called the Deutsche Werkbund that recognized that manufactured objects were just unusable. And so the German government funded work in making things more usable, what began to be called design. So it was an economic imperative to design things that were comfortable, that were manufactured. And those purists out there in design who tell me, John, you're so wrong. Design's not about business. It's about heart, you know? And it is about heart. It's a beautiful thing. But if you look at the Bauhaus, 1910s, 1920s, the founder of the Bauhaus, Walter Gropius, very famous design leader. Years later in his life, he is quoted as talking about how design has an important cultural value, but most importantly, it has a pecuniary value. And I never heard this word before, and I Googled it, and it means money. So there you have it. Walter Gropius, father of modernism, et cetera. So design's important right now, and it's a great time, and no better people could describe that than people I will be inviting up to sit down here. Thank you. I want to introduce our panelists this evening. This is Sonny Vu. He is CEO of Misfit Wearables and is as self-described as the accidental entrepreneur. That's a good one, like, whoops, you know? He dropped out of a PhD program at MIT in computational linguistics. I actually took one of these classes as an undergrad. He studied under the great Noam Chomsky. Isn't that, oh, see, that was good. But while he was a PhD student, at MIT there's these 50K competitions, and he was allured by the competition to create his first company, Firespout. And I read some of the interviews about him from this era, but one of his main lessons from that period was, quote, a great idea and great technology doesn't always yield great profit. So invention and company making combining them is something that Sonny Vu has done all his entire life through many companies. So welcome, Sonny. Right. On his left is Jason Mayden. Jason is Vice President of Design at Mark I and is a fellow at the D School. He's also, his other Stanford affiliation, he's also a GSB grad. So he has D School and B School. Pretty powerful combination. Before his time in Silicon Valley, he led footwear design at Nike for the Jordan brand. Let's pause for a second. Jordan, Michael Jordan, right? And he, among many things, he designed the Air Jordan 2009 himself. Welcome, Jason. And last but not least, Lynne Chou, who is the person who inspired this event to occur. She's partner at, of course, Kleiner Perkins in the Life Sciences group. She's a fellow Stanford grad like Jason, but also an HBS grad, so there may be a little bit of tension here. Lynne focuses on digital health and connected devices, and works alongside entrepreneurs to develop impactful technologies and therapies for improving patients' lives. What an awesome panel. Okay, first question is for Lynne. So Lynne, you were at that event, Uber, like a lot of people were there, and you had this moment, that kind of Jerry Maguire moment. You said this design thing, I could see this thing, whatever. So why do you think design is getting traction in the health space now?
I think there are kind of two fundamental areas of why this is important. I think one is a structural shift of what's happening in healthcare today. And the second is kind of a cultural technology shift that's happening today. And so from the kind of structural side is everything that's happening with ACA, and you read all about it. But fundamentally, we are going to be empowering consumers more and more with healthcare choice, with payment, with delivery, and we're reinventing how healthcare is delivered to individuals. So everything, if you can think about it, is at the nexus of consumers. And so I think that's a very powerful notion to what's happening kind of technology and culturally in the healthcare ecosystem. You know, previously I used to say that things were designed, what I call for the inside out. Life science apps rate very low in terms of usage and uptake. And really what we should be doing is designing outside in, designing for what engages the consumer, encourages them to really take ownership of healthcare and make those healthcare decisions.
So Jason. So Jason is an art school graduate of the College for Creative Studies, a CCS. It's a great school in Chicago. And in art school, you learned what design was. Mm-hmm. So in art school, before you came to Silicon Valley, before you worked at Nike, all that stuff, what was design back then?
So design in art school, and CCS is in Detroit. I want to make sure people know. Yeah. I think design, in art school was exploration. It was limitless. It didn't have real boundaries at that point when I was in art school. There was no such thing as a title. People didn't necessarily understand why I wanted to cover the foot. They thought, you have the whole body and you can put that in a car because it's Detroit. But for me, footwear was transportation. So I think it was really about personal expression and how I put my filter on the world at that point.
What is different about what you learned in school and what you learned in Nike as you rose up as a leader?
That's a great question. So what I learned in art school is that there's a false phenomenon. We talk to people that know us. They speak our language. We're comfortable with them. You're with other creative people. You get to corporate America, you're the only person advocating on behalf of everyone that's like you. In corporate America, you're rewarded for collaboration, what you collectively do. So it's not an individual sport anymore. It really is about who you know and how you navigate through communication. So you have to design conversations in corporate America instead of products. So that was the core difference.
No, I was just talking to one of our younger partners here about that very thing, that it really is about the people. And it was so great to talk to Sonny. We were talking about how you designed something exquisite without the Apple infrastructure ecosystem. Can you share that a little about that context of how did you make something so exquisite as a startup?
Sure. So we originally did not plan on doing activity trackers. We actually had another product that we raised our Series A financing on, and then before we pushed the go button, I was thinking, there are these other companies making so much money doing step counters. and this other fairly radical concept. It was a wearable that it's still sitting on our shelves, and I'm like, I don't know if this is going to work, but maybe we should just do like an MVP, whatever, you know. And so we did the Shine thing, and then so what we did was we actually looked at all the Amazon reviews of, you know, Fitbit and Jawbone and Nike. We read like 5,000 reviews, and at the end of it, we thought, whoa, there are some pretty obvious white spaces, things that are durable, beautiful, no charging. And it's unclear that people actually need a display. Everyone was looking at the goal line on the Nike Fuel Band, so why don't we just put that and nothing else? And we had a screen, and we took it off. We had a button, we took that off. We put out this thing, and the crowdfunding campaign kind of validated, like, oh, maybe we should launch this product. That I think it's going to work there. I think we just learned a lot of lessons. The other thing was around, but there were other decisions that we took around materials. So materiality, the physicality of the product was something that was that I felt that kind of came out in these reviews. I really think this whole doing the Amazon reviews thing was like one of the best things we ever did.
What is it made out of?
Aluminum. Aircraft.
So it's beautifully crafted aluminum, and you talked about, I want to talk about over-designing.
Yeah.
Because I think that some people want to design it to perfection, whatever, but it's sometimes a bad idea.
Man, that was a hard decision because we couldn't actually communicate out of the device because it was a Faraday cage. It just like contained, you know, so Bluetooth doesn't pass through metal so well.
I knew about that.
So we kind of knew that, but we figured, we'll figure it out, you know? And so we actually created an entire communication protocol around that using ultrasonic.
But it was that moment where you've got this great design idea and you have that proverbial Steve Jobs moment, I'm going to make it out of magnesium or whatever, because you read the book.
Right.
And you're like, this is how to do it.
Yeah.
And you're like, oh no. And Jason, did you ever have that experience at Nike where a similar thing occurred where you had the ego driving this amazing idea?
Oh, absolutely. It was called Every Day. But I mean, the one thing I learned from one of my mentors, Tinker Hatfield, who's like the Michael Jordan of design, is that great design is great restraint. So I had to exercise restraint. Just because I could didn't mean I should. So a lot of the things we would do was always bring it back who we were designing for, and we obsessed over the athlete. Like, can I shave this weight off this garment because that's the difference between a gold medal and a silver medal? And if my ego got into the conversation, and this person has trained their whole life to win this event, and because of my ego, I didn't want to back off this material, I've just now compromised their dream. And so as a former athlete, I know how hard they work, and so I had to put myself in their shoes and realize that every ounce, every stitch, every seam matters to them.
Restraint. I like that, restraint versus constraint.
Yep.
That's elegant, thank you. You know, Lynne, so, you know, I've seen you enter this design world with such passion and curiosity, and there's just so much interest in what you do. And so, given what you're hearing about design, over-design, design used well, what are your takeaways so far?
Yeah, I mean, I think it's amazing what you were saying, designing for who that person is or whom you're designing for, and then over-design on what this means for functionality in the healthcare ecosystem. And as I think about healthcare design, one thing that we really have to realize is that most of healthcare still is a B2B2C world, right? So we have to work through providers or payers or employers or otherwise to then get to patients and consumers ultimately. And I think we are working our way to a B2C world, but we're just not there yet. For instance, one of our companies, Accel, when we thought about the design of what the digital platform, it's a connected device, you know, you can think about the patient, but we also had to think about kind of really how we were going to sell this product and this service. And office staff of ophthalmologists was going to be a very big, I think, influencer. So we had to think about, okay, what is the office staff going to think about this and how they're going to project that to the consumer? Or I think about Spruce, which is another KP portfolio company, and thinking about when you have clinicians on the other side and thinking about, you know, in the consumer world, we like synchronous discussions, but is that really right in a healthcare B2B2C world? Maybe asynchronous is what makes sense given physician workflows and what we're designing for. So I think it's really important in healthcare when we think about these models is really thinking about the business model and how that influenced design.
I want to thank Jason and Sonny, and we're going to hand over to Lynne. Keep on going.
Great. Well, I wanted to introduce one of our designers at KP and actually in one of our portfolio companies, Spruce. So Megs, please. Really excited to kind of introduce design, and then we'll follow up with another panel.
Hello, everyone. Thanks for coming out tonight, and thanks to KP for holding an event about design and healthcare. It's something that's been kind of near and dear to my heart for the past 2 years working at Spruce. And if you think about healthcare, it's the year 2015. Technology has really changed our lives. With my phone, I can get a ride across town, I can have food delivered to my doorstep in less than 15 minutes, and I can send a photo to my friend instantly. But in healthcare and medicine, it doesn't quite feel like the year 2015. The products that we have as consumers that delight us, that are frictionless and seamless with our lives, they just don't exist. There's a lot of friction in healthcare. There's a lot of not a lot of delight. Doctors train for years to develop their medical expertise and hone their skills at providing great care for patients, but once they enter the field, they're treated a bit like a commodity. Many physicians find themselves in a position with jam-packed schedules, with patients booked in 10 to 15-minute intervals. And on top of this unrealistic schedule, they're finding themselves doing at least 5 to 9 hours of administrative duties and paperwork each week. It's no wonder that physician job satisfaction and morale is at an all-time low. And I think as designers, PMs, engineers in this space, we really have a responsibility to design experiences for physicians that are just as good as the experiences that we would design for consumers. And it's not just about applying a layer of design on top, applying a layer of technology on top. And that's kind of what's been done, maybe not design, but technology with many electronic medical record systems. And as a result, the EMRs are frequently cited as a source of physician job dissatisfaction. While doing some initial research for Spruce, one physician was explaining the process to refill a prescription for a patient, and she called it death by 1,000 clicks. This data entry, this interaction is so cumbersome that some physicians have hired medical scribes that shadow them and chart visits so that they can focus on the patients. Software shouldn't be making things worse for physicians or require physicians to increase their practice staff and overhead. And we shouldn't be asking them to adapt their workflows to technology. Instead, there's an opportunity to look at doctors' existing workflows and design ways to enhance their processes, make them more efficient, and get out of their way so that they can focus on their patients. We should be designing tools for physicians that are a joy for them to use. And if we can design systems that act like a partner, we can help doctors be better doctors, be the best doctors they can be. And they can put the focus back on the part of their job that gives them the most satisfaction, caring for their patients, taking the time to listen to their patients, answer their questions, explain their diagnoses, and thoroughly discuss treatment options. So let's put thoughtful, deliberate effort into designing tools that act like partners with physicians so they can focus on their interactions with patients. Because at the end of the day, it's the doctors and other caregivers who are really the heroes of the patient's journey, and it will always be their job to put the patients first.
So it'd be great for each of you to kind of describe the company that you're with and quickly kind of what's your design inspiration?
I'll go first. I'm at Spruce Health, and it's a mobile healthcare clinic in your pocket. So we connect patients with board-certified physicians for the diagnosis and treatment of common medical conditions. And my design inspiration is really, making taking care of yourself less of a chore, making it more accessible, and really making a meaningful impact on people's lives.
I'm Patrick. I'm with Practice Fusion. We are one of the dreaded electronic medical health systems, but the best. It's a cloud-based platform. Inspiration, it's not often as a designer that you get to feel like you're actually making a difference, minor though it may be, in the lives of people, in this case patients. And working for designing for a healthcare product is a continual source of inspiration because of that fact. You feel like there is some small difference you're making in the lives of providers, ultimately patients, and more broadly healthcare industry.
Hi, I'm Michelle from Mango Health. So Mango Health is, so we designed an app that helps you remember when to take your medications. And we decided to go after medication adherence first because it's sort of the first critical step for patients. We can figure out or kind of assume what condition that patient deals with every day, and we can bring in a little bit of delight every day when that person takes their medication. Design inspiration is, just bringing some kind of humanness, some thoughtfulness, some fun, some kindness into the space.
I always love hearing how people came into healthcare and in digital health especially, and it's a really binding kind of mantra throughout everyone in the space, so it's really great. Well, I'd love to dig in here, because what's so great about each of your companies is that you're designing for both physicians and consumers and patients. And so there's a duality that I would love to kind of get your thoughts on is, A, what are the differences as we think about designing for physicians versus consumers? And is there a natural tension sometimes? So I've thought about the use case sometimes where, physicians like a lot of data, right? But then how do you create a delightful experience for the consumer?
I think data visualization is going to be a key player in both the provider and the consumer space.
With Spruce, the whole visit is asynchronous, so thinking about designing a visit for patients where they're never actually in the same room with the doctor, we kind of made the intake process for patients a little bit more conversational. You're being asked questions and you're answering them. Then on the physician side, when they're looking at all the patient information, we've kind of stripped out that conversation and just give them what they need so they can really process the information that the patient provided. We put photos of the doctors at key moments throughout the experience so people understand that there's a real person on the other side and that they're not just interacting with an app.
Yeah. Great. So Patrick, it's really interesting with Practice Fusion. One thing on the provider side to think about is that there are a lot of different types of providers or individuals in the equation of healthcare when we think about really delivery of health. So we've got physicians, we have patient coordinators, nurses, et cetera. How do you think of design differently for all those individuals that are kind of helping to deliver care?
Well, you have to. These people serve different roles within the practice, and you have to think very carefully about what it is that they want out of the EHR and what their day-to-day needs are. So in a sense, the product we build has to mirror the structure of the practice in the sense that it is comprised of component parts that must function successfully on their own, but at the same time they have to work together, just as the individual components of a practice do. So, for example, the front desk person will spend a lot of time in the scheduler. They will need to make sure that the right patients are meeting with the right physicians at the right time for the right reason. So we spend a great deal of time exploring ways to make that flow more efficient for the front desk person. The nurses who meet one-to-one with the patient and are charting a lot. How do we anticipate their patients' needs? It's our job as the designers to think of systems that will remove this barrier between the physician and the patient, make those interactions more meaningful.
So it's interesting. It's almost like the definition of delight from that perspective is almost getting out of the way as much as possible in that scenario. And then, of course, providing useful data and making sure, from workflows that it makes sense. Yes. Well, Michelle, from a Mango standpoint, we talk a lot, and if we look at consumer digital, you can argue a lot of that's from millennials, immediacy of goods and services, but you're really dealing with people who have 4 or 5, medications they're probably older. How do you think about design if it's for the young or the elderly or someone with chronic disease or otherwise? What makes you think differently on design for that that consumer?
So our typical consumer is probably like gaming, a little bit, well, maybe like Candy Crush gaming. It's a little bit older, it skews slightly female. And so, I think about this person all the time. Let's call her Betty. And, maybe Betty's at home and she's juggling like 3 kids' schedules and her husband. And, she's doing all the stuff, but all of a sudden she's like managing chronic conditions. Maybe she gets diagnosed with like maybe 3 new chronic conditions. She wants to feel like she's on her favorite social media app, or she wants to feel like she's playing Candy Crush. That kind of stuff, it translates. You look at the demographic of people that play those kinds of games, and it's very wide and it's very accessible.
From another standpoint, Megs and Michelle, also as you think about from a patient approach, have you thought about how design might be different for people with different conditions or disease states? So I just think about, if you have the cold and the flu and it's episodic, right? Or what if you have cancer or a chronic disease? Do you think that influence their engagement levels, how they think and how you think about design with that individual?
My goal is to be able to design for all stages, from diagnosis to just daily management. And when I think about this, I go straight to the type 2, type 1 diabetes split. You got somebody that's type 1 diabetic, they probably know all about their condition. They were probably born with it. They've been in the daily grind every day, just like pricking themselves, or they have a little thing. So designing for them, it's just about really bringing delight, just like 2 seconds of delight for them every day. But then there's like the person who just gets diagnosed with type 2 diabetes. They have no idea how to manage that condition. They need tools and information and all that stuff to empower them to manage that condition. So I do try to think about that, and how we can flow them into different ways of the app.
Yeah.
With Spruce, we've really designed it in a way where people are able to build a relationship with their care team, which is a physician, a board-certified dermatologist, and a care coordinator, so that even after they've been treated, the care coordinator is checking in, making sure that things are going well for them, and continuing to have high quality care on an ongoing basis, even though they're never really seeing the doctor face to face.
Well, thank you so much. Thank you all for coming here. I think really John and I really felt that this is the start of a conversation, and there is so much opportunity in digital health for everything that we're talking about here, and we're so excited for those designers who are coming into the space and just, again, reimagining what healthcare can be.